Hi, my name is Victor, and we are health experts speaking on behalf of the Ministry of Health about the issues and living conditions within Nigeria. The three issues we will be addressing are malaria, HIV and AIDS, and diarrheal diseases, which are also the top three death-causing diseases between 2005 to 2015. During that decade, malaria's death rate decreased by 51.4%, HIV decreased by 31.8%, and diarrheal disease decreased by 38.9%. However, even with these declining death rates, they are still the leading life-threatening diseases in Nigeria. This can also be linked to the country's top risk factors, which are child and maternal malnutrition, unsafe water and sanitation, and unsafe sex. The graph on the right shows the top 10 causes of changing DALYs, while also linking them to the type of diseases. These three risk factors are the most associated with the three diseases we mentioned earlier.
57 million Nigerians who currently don't yet have access to water and 60,000 children under 5 years old die every year from diarrheal diseases caused by poor water and sanitation. So we highly recommend make some change in short term by working closely with UNICEF's water, sanitation, and hygiene team. Nigerians can learn a lot about basic hygiene practices from them. It's also essential for the government to aggressively implement the water investment, mobilization, and application guidelines to facilitate state-level policy and plan development. In addition, activate water resource management system also is a fundamental thing for them to do.
With regards to HIV/AIDS, the country can prevent or reverse the escalation of these epidemics, similar to how Uganda did in the 90s. There are 5 steps that can be taken. First, it must increase the availability of HIV prevention resources. Secondly, it must educate the people about this disease. Thirdly, the president and other leaders must openly acknowledge the reality of this disease. Fourth, the country must promote partner limitation and encourage people to stay close to home with respect to sexual partners. And lastly, Nigeria must engage multiple channels to reinforce the issue through mass media, churches, political appearances, and...
My name is Ai, and I will be speaking about malaria prevention. First and foremost, it is important to educate the people about malaria so that they have a good understanding about the symptoms and the immediate care for it. They must have access to treatment and professional care. In addition, in order to reduce the mosquitoes population, we must larvicide them, incorporate residual spraying and insecticide-treated nets into communities, and eliminate the source by treating infected people. Over the years, ITNs have proven to be a cost-effective way to prevent malaria, and they can be routinely distributed through clinics, schools, and community activities to reach the most vulnerable population. The priority care goes to women and children under 5 years of age.
The number one risk factor contributing to 3 immediate public health issues are child and maternal malnutrition. The result of malnutrition is diarrhea, low respiratory infectious diseases, and nutrition diseases. Approximately 18% of the total DALYs are affected by severe acute malnutrition. With regards to malnutrition, the country must continue to work with federal and state ministers of health and UNICEF to give 400,000 malnourished children access to clinics and treatment. Compared to the traditional approach of treatment in hospital beds, a community-based approach to care and treatment has proved to be more effective. In addition, to reduce risk of malnutrition among children, the country can educate Nigerians across all 36 states and aggressively promote the nutrition-based approach of food choices.
The country needs a strong governance system so that important policy changes can take place. For instance, policies for water supply and sanitation service delivery have not been successful in reaching the vulnerable population. However, if the action plans can be taken effectively, it is able to reach the vulnerable population in need. The expected timeline is 5 to 10 years, given that behaviors take time to change. We hope these suggestions can be implemented effectively and increase the standard of living for many. Thank you.